everyone, myself Afeefa Jabin, third year MBBS student from Antigen State Medical University. Imagine a world where a simple cut or bruise could lead to serious complications. For millions worldwide, this is a daily reality. Welcome to a deep dive into hemophilia, a rare but life-impacting bleeding disorder. What is hemophilia? Hemophilia is a rare inherited bleeding disorder where the blood doesn't clot properly due to deficiency or absence of specific clotting factors, which are the proteins essential for blood coagulation. This leads to prolonged or spontaneous bleeding, which can be life-threatening if not managed properly. What are the types of hemophilia? Hemophilia is mainly divided into three types: hemophilia A, B, and C. Hemophilia A, which is also known as classic hemophilia, and the main cause of this is the deficiency of clotting factor 8, and the prevalence it accounts for approximately 90% of hemophilia cases. Hemophilia B, also known as Christmas disease, the main cause of this is deficiency of clotting factor 9, and the prevalence is approximately 15% of hemophilia cases. Hemophilia C, and the main cause of this is deficiency of clotting factor 11, and the prevalence is extremely rare and typically less severe. Causes and inheritance of hemophilia. Hemophilia is most commonly inherited in an X-linked recessive pattern. Males have one X and one Y chromosome. A defective gene on the X chromosome results in hemophilia, while in females have two X chromosomes, typically carriers if they have one defective gene, but may exhibit symptoms if both X chromosomes carry the defect. Acquired hemophilia can occur when the immune system develops antibodies against clotting factors, leading to bleeding issues. This form is not inherited and can be associated with autoimmune diseases, pregnancy, or certain medication. Symptoms of hemophilia. Symptoms vary based on severity of clotting factor deficiency. In mild hemophilia, bleeding episodes are infrequent and typically occur after surgery or trauma. In moderate hemophilia, bleeding episodes occur after minor injuries. In severe hemophilia, spontaneous bleeding episodes are seen, including into joints and muscles are more common. Common symptoms of hemophilia include easy bruising, frequent nosebleeds, prolonged bleeding from cuts or dental work, unexplained joint pain or swelling, blood in urine or stool. Now let's look into diagnosis of hemophilia. Diagnosis mainly involves blood tests in order to measure clotting factor levels, genetic testing to identify mutation in clotting factor genes, and also family history to determine inheritance patterns. Early diagnosis is crucial for effective management and to prevent complications. Treatment options for hemophilia. First one, clotting factor replacement therapy. Regular infusions of clotting factor concentrates, factor 8 for hemophilia A and factor 9 for hemophilia B to prevent or control bleeding episodes. Next treatment is desmopressin. It is used in hemophilia A cases to stimulate the release of stored factor 8. Next treatment is antifibrinolytics, medications like tranexamic acid to prevent the breakdown of blood clots. Next is gene therapy. In hemophilia A, Roctavian is an adeno-associated virus vector-based gene therapy that delivers a functional copy of factor 8 gene to the liver. It is approved in US in June 2023. In hemophilia B, Hemgenix is a gene therapy that introduces a functional copy of factor 9 gene. It is also approved in US in November 2022. Next treatment is monoclonal antibodies. Hemlimbra, it mimics the activity of factor 8, reducing bleeding episodes. Alhemo targets tissue factor pathway inhibitor, enhancing clotting. Himpavzi inhibits a tissue factor pathway inhibitor, increasing thrombin generations. So these therapies offer alternatives for patients with inhibitors or those who develop resistance to traditional factor replacement. Stay informed and support the hemophilia community. Like, share and subscribe for more insights into rare diseases and medical breakthroughs. Thank you for watching.